Okay, so now we're going to talk about one of my favorite topics in programming, which is exercise redundancy. And what generally happens with this is a lot of trainers really get caught up in endlessly addressing every perceived dysfunction through corrective exercise. And this kind of really ignores how resilient the human body is. And the body can function well, and it's normal to have small imbalances. It's totally fine. If we overcorrect, we can actually limit the ability of the person to adapt and evolve and move on. So what we need to do is we need to first of all make sure that we don't address every small issue as a dysfunction. Sometimes people's form just goes off every now and then. Sometimes things just hurt, and it's okay just to do that and just to manage load and then move on. So it's really, really important that we look at that, and we need to view dysfunction as a way of basically adaptation, and that most people are going to have some form of minor movement variation. Okay, so that's totally fine. And we need to then also think of, if we're constantly correcting everything that goes wrong, is this actually inhibiting someone from moving forward? And very often it does. So the first thing is the screen, and also educate the client on the body's natural resilience. This is why with the screening, I always talk about what someone will thrive with rather than what they should avoid, and that lifting it around back will hurt them. It certainly doesn't help. We don't want people to feel fragile, and we want them to be able to feel strong and confident in what they're doing. Now, with a corrective exercise mesocycle, it doesn't mean it's a bad idea, but what it means is it shouldn't be forever. It should last for about 4 weeks. The time frame is generally enough to then get someone into more productive, proper training. And if we're just doing purely corrective work, it may be a little bit counterproductive. Okay. A really good rule of thumb that I have is that if someone still needs it after 4 weeks, it's generally the wrong strategies are being used and you haven't done a good job at the beginning. So really important to use the screening techniques that we teach you to make sure that you do the right job at the right time. So 4 weeks is good. Any longer than that basically stagnates progress, makes people bored, and we need to move on to the next phase. Now, if someone has an active injury, that's when we may need to do it for a little bit longer. Okay, so the severity of injury will determine that, and you need to cooperate and collaborate with the medical professionals. So we also need to be aware that corrective exercise principles that work with non-injured clients are going to work with clients of injuries. It's not certainly the case, because a lot of the time the severity of injury and the timeline of healing will be significantly different. An example would be an ACL repair. So we'd say someone with knee pain, you can get them pretty comfortable within 4 weeks. That's totally fine. ACL repair, you're looking at 6 to 12 months for restoring everything, because their hamstring's basically been cut apart so they can use that as an ACL. So it takes a little bit longer to go through that. There's a lot more adaptation, a lot more corrective strategies to use. And you need injuries for specific areas. Sorry, you need protocols for specific areas, and different tissues heal at different levels. So a disc, for example, will take about 6 weeks, and most people's disc will heal by itself. But for some people with like an extension-based spinal injury, like spondylolisthesis, it may actually be a very long recovery period. Particularly if they've fractured something, or they've got like an actual shift of the vertebrae, it can be a very, very long process. Now, for clients with past injuries, this is when corrective exercise becomes like a maintenance routine. So if someone's had a significant back problem, for example, and they still get flare-ups, I actually will generally keep corrective strategies in there just for the client to actually feel confident in that. So a lot of the time, if a client is older, they've had a previous injury, they like doing their corrective exercises because they helped in the past and they help someone actually feel better about going forward. Now, you can keep on in progressing these and moving these forward, but a lot of the time it can actually help people just feel better. And who are we to say that a client shouldn't do a bird dog because it makes them feel better? We shouldn't be coming in and saying you're not getting any more training stimulus. It makes them feel confident about getting stronger in the gym. We should certainly be doing that. Now, injury management, we should also make sure that we don't keep it redundant. Okay, so we need to basically progress it and overload those tissues over a period of time. It's the exact same type of strategy as you use for any other client, because if we do the same stuff again and again, what will happen is that injury only heals to a certain point and then it stops. The only time we keep it for longer is the client needs it from more of a psychological perspective. And if you can look at that 4-week strategy for most of your corrective exercise programming clients, you're going to be in a pretty good place to move forward with them.